So hi, Mr. Jones. I'm Taylor. I'm the physical therapist going to be working with you today.
Nice to meet you.
So what brings you in?
I have a wound on the bottom of my foot.
Okay. And is this the first time you've had a wound like this?
Yes.
Okay. Do you know what brought it on?
Just appeared.
Just appeared. Okay.
Yeah.
I noticed on your intake paperwork you said you have diabetes. How are you managing that?
I test my blood sugar once a week,
Okay.
and it's usually around 250.
Okay.
And I have an A1C of 9.
Okay. So what are your eating habits like?
I just kind of eat whatever I want.
Okay. And what is your shoes like?
I've been wearing the same shoes for about 2 years now.
For the last 2 years?
Yeah.
Okay. Are they special shoes for diabetes or anything like that?
They're just normal old shoes.
Normal sneakers?
Yeah.
Okay. So, with your blood sugar and A1C being high, that's a little bit of a concern for us. So, diabetes can affect your microcirculation, meaning it's harder for blood to move around in your system. And I also noticed in your intake paperwork that you're a smoker, and that also can affect your circulation. So those are two things that are a little bit concerning with your past medical history. I also saw that you were on insulin and metformin. Is that right?
That is correct, yes.
Okay. So the insulin's for your diabetes, and so is metformin. And metformin really only works if you do proper diet and exercise with it. So we might get you in to see a dietitian or something like that to talk to you about your eating habits, okay?
Okay.
So I know when we talked earlier, you said for your job you do a lot of sitting, and then you like to play pool, so that's a lot of standing, but you don't do a lot of exercising besides that. So we probably want to get you up and moving in different ways. Right, so now we're going to be doing the systems review. So for cardiovascular, I want to take the pulses. So I'm just going to move your foot and you touching your foot, okay? So first I'd find dorsal pulse, and it feels like 2+, so normal. And then I'm going to come over here to post pulse. And that feels like 2+, which is also normal, which is really good. Also with the cardiovascular systems review, I would take blood pressure and heart rate. So then for pulmonary, I would do his O2 stats. For neuromuscular, I would do ankle, knee, and hip range of motion. So I'm going to do a test for neuromuscular. So what I'm going to be doing is a monofilament test. Can I see your hand real quick? So this is what it feels like. I'm just going to be poking you with this on your foot. So I want you to close your eyes and tell me when you feel this.
Okay.
Let's get this area because you're blue. Did you feel any of that?
I did not.
Okay, that's okay. So that was a 5.07 monofilament, so that means he has diminished protective sensation. So now the only two areas left would be gastrointestinal or urinary, and we don't have to worry about those as much because this is a wound on his foot. So now we're going to do the wound exam. So this wound is located over the first metatarsal head on the patient's left foot. It has about 20% slough around some of the edges. There's 20% granulating tissue and about 60% gray wound bed, which can be a sign of arterial issues. So the peri-wound area has macerated tissue from 3 o'clock over to 11 o'clock, and there's hyperkeratosis as seen in the callousing, which is mostly in this area. The wound edges are even and round. The drainage that was coming from this wound was serosanguinous drainage, and it was minimal. I'll now do a measurement of the wound. So, in centimeters, the longest length of the wound is about 2 centimeters, and the longest width perpendicular to that is about 1.5 centimeters. That makes the total surface area about 3 centimeters. So I would say that this is a stage 2 neuropathic ulcer because it's over a bony prominence on the plantar aspect of the patient's foot. It has round edges and hyperkeratosis. I would also think it's a neuropathic ulcer due to this patient's past medical history of having diabetes. For this, I would do sharp debridement of the callus area in here, and I would also do some autolytic debridement. This would be done by the dressing that I choose. The dressing that I would do for this patient is a semi-permeable foam, and it's going to have some self-adhering bandaging that comes with it. I want to do this to absorb any excess exudate and to provide cushioning, as this is on the plantar aspect of his foot. This is going to be my primary dressing. I'm also going to put this patient in a total contact cast to alleviate any pressure for the wound and provide the best environment for healing with the offloading. So now that we've treated your wound, I want to educate you on a few things that we can do that's going to help you heal this, okay?
Okay.
So getting your diabetes under control is going to be a really big one, and getting your nutrition under control. So we need you to be checking your blood sugar more, and we need you to keep an eye out on your blood sugar. So we want you to go back to your primary care doctor so you can talk to them about better ways to manage it. I also want to talk to you about stopping smoking. I know you said that you've done that before, and it might be a good idea to do that again just to help with your circulation. So I would also think that we need to go see a podiatrist about your shoes. The shoes that you have, you said, are 2 years old. They have holes in them. They're not very good shoes, and they're not very supportive. And with your feet and not being able to feel them as much, you need something that's going to be more protective than what you have. Also, with not being able to feel your feet, you need to be doing feet checks almost every day. So this is going to involve you getting a handheld mirror, holding it up to your feet, looking at your feet. Go ahead and making sure you dry them fully whenever you get out of the shower and get in between your toes. We need to make sure we take really good care of your feet.
Okay.
So with the dressing that we've given you, you have to offload, which means that you're not going to be putting a lot of pressure through your foot. So we're going to be working on different ways to keep you mobile without putting a lot of pressure through your feet. Offloading is going to be one of the best ways to get this wound to heal. Okay?
Okay.
All right. Do you have any questions for me yet?
Not right now, no.
Okay. Okay, so you're going to have some long-term challenges when trying to treat this wound. The biggest one is going to be getting your diabetes under control. That's going to be really important for your wound healing. We also want to make sure that you keep up doing some range of motion activities while you are in your total contact cast, just so we can keep some blood flowing and things like that. Your pool league is going to be a little different for a while because you're going to be in that total contact cast. So we need to make sure you're offloading. So even when you come out of the cast, you're going to try and walk around more. Don't stay in one position for longer than 20 minutes. So sit for a little bit, and then you can get up and do a couple rounds. So stand for about 20 minutes, walk around some. It's just important that you're not in one position for too long.